Stability. Not talking about balance and not falling over. More a point is joint stability. It's often overlooked or misunderstood in the realm of training. It's a foundational component of both force production and injury risk management. We all know unstable things usually break. Without adequate stability in joints, like key joints, like the shoulder, the hip, spine, spine is considered a joint, multiple of them. Progress in strength, power, and skill become increasingly difficult. An unstable joint can compromise movement quality. It could reduce efficiency of movement and increase the likelihood of a compensatory movement pattern. So that can lead to overuse injuries or just straight up injury or acute damage. Happens right then and there. Stability is not merely a secondary concern or a corrective afterthought. It's critical, to training. It's a feature that supports every movement, and performance goal. Ignoring stability can lead to joint pain, like a chronic joint pain, decreased longevity in doing athletic movements or activities, and also just a decrease or diminished overall general function, right? Just having an unstable joint. Now, what can we do about this? What does this mean? The challenge lies in recognizing stability as a trainable quality, right? That we can progressively develop rather than a fixed limitation. So stability isn't just something, it's either a yes or a no. It's something that has many levels and can be progressed as it moves, as we go along in the training program. So we really need a strategic approach in exercise selection when it comes to stability, and the progression of those exercises, that we can target neuromuscular control and basically creating the muscular endurance necessary to maintain joint integrity. Especially under load. So we have to recognize what we could do in the training, so we could really focus on the neuromuscular control. I talk about this a lot. And then the muscular endurance necessary to maintain the joint integrity and stability. So, and all of that happens under load during a movement, not just standing still, holding something, which would be under load, but it has to be during that movement. So if I'm dealing with the shoulder, whether it's upright rows or shoulder presses, we have to have the muscular endurance and the neuromuscular control, brain to spine, that whole muscle communication factor, that all has to be worked on and progressed. Again, it's not a yes or a no, have it, don't have it. It's, okay, if we don't really have it, we could now baby steps and we can get there. So stability is something that we really should be focusing on a lot with clients, and a lot of trainers don't do it. They say, shoulder's a little wonky doing that. Okay, we're just not going to do that. Or all they do is just lighten the load and do the exact same movement pattern. But like we said, you could, in unstable joint, you could get a compensatory movement pattern. So something's compensating somewhere. Maybe a scapular is moving in a different direction, or the lumbar is twisting. You're getting a little thoracic action going on, or even the hips are misaligned just to get something overhead. All these things can happen. So we have to look at joint mobility, stability, strength, and everything during movement at baseline and under load. So stability is very important. Thanks.